Hi there, this is Melanie with Angelo Kidney Connection, and I just wanted to say a few words about Dialysis Access. If you haven't started dialysis yet, you will learn that there has to be a way to clean your blood, and they call that a dialysis access. There are just a few options. There is the temporary catheter that they will put in an emergency here in your jugular. They will also put in a tunneled catheter, which is tunneled in and comes out about right here on your chest. And those, we call them IJs, and they're a little bit more permanent. They can be kept for a couple of months. And then there's the permanent access, is which they put in your arm, typically in your arm. It can be in the upper arm, it can be in the lower arm, and there's two kinds. There's the fistula, which is your own artery tied to your own vein. The surgeon literally takes a vein and an artery and sews them together, and that creates the fistula. The other kind is an artificial tube that they will put in. They call it a graft. It's artificial. It's made out of biocompatible material. There's several different kinds. But we're just going to call it a graft because it's artificial. And what they do is they go in and tie one side to the artery and one side to a vein. And with that large graft, large piece of plastic, a much larger amount of blood is able to get through to get cleaned. Now, pros and cons. If you can use your own artery, your own vein with a fistula, that is the best. Those last the longest, they have the least amount of complications. However, once it's created, once the surgeon creates it, you cannot use it for at least minimally 6 to 8 weeks, sometimes longer. It takes a while for that fistula, for that vein to grow and grow with the blood flow. They will have you do exercises. They'll have you squeeze a ball, lift some weight. Maybe we tell people to grab a can of beans, just lift weights. Do that. You can do it during dialysis. You can do it while you're watching TV, and that'll help grow that fistula. Now, the graft, those are pretty much ready pretty quickly. We usually say a week or two, but in an emergency, we can use it pretty darn quick. Complications of a graft, they don't last that long. It's plastic, so it tends to clot. Blood sticks on it, and it tends to clot. Also, after your technicians and nurses are sticking it, with the needles, it creates little punctures, and if they're not rotating the needle sites and they're just sticking in the same spot, you can wear it down. You can Google puncture sites on a graft, a dialysis graft, and there's some pictures where the staff are sticking in the same spot, and it literally looks chewed up. So, grafts don't last forever. I would say on average, and this is just me talking, average 3 to 4 years. A fistula can last 10, 15, 20 years. Let's talk about the catheter. We consider all catheters temporary. And I know there's some folks out there that have had their catheters a long time, and they're the exception. Usually a catheter is put in while the fistula is healing, while the graft's getting put in. There are some people that are absolutely do not want a graft or a fistula, and they keep the catheter, and the risks are infection. This is my little one. She is asleep. If you're wondering why sometimes I'm whispering, this is why. With the catheter, the problem is infection. It's tunneled under the skin, but it hangs out, so it's exposed. So you can get a skin infection. You can get a staph infection. The other thing is you have people opening and closing it, and you can get infection through there. And it's right here, tunneled in to your artery. And so any infection, any type of bacteria can travel inside the tube and can infect your heart. You can have infection and growth in your valves. They call that vegetation. That is serious. You can die from it. So catheters are not the best option. We've had patients who have been on dialysis for a very, very long time, and unfortunately, they have a graft in one arm, doesn't work. They go to the other arm, they maybe go to the leg, and eventually they run out of places to put it. So a catheter may be their last resort, and that's all they've got. Another problem with catheters is once they're clotted, they can move it to the other side, and they can go back and forth, and eventually there's so much narrowing that they can't get the catheter in. And we've had patients that said, this is my last spot. After that, it's emergency dialysis in the hospital. Let's talk about sticking, and that's probably the scariest part for someone going on dialysis, is sticking the access. And yes, it takes 2 needles. One needle pulls the blood out, goes to the machine, gets cleaned, and the other returns back through the other needle. So there's 2 needles. Let's talk about the graft first. With the graft, it's pretty simple. They can feel the graft typically in the arm. They feel for it. They stick in the middle of the graft. They go in not too far. They have to go in at an angle, tape it down, put in the next one. And you use sharp needles for that, sharp butterfly needles with a needle covering to like a protection. And those needles stay in for the whole time you're on treatment. Now, fistulas. I would say back about 15 years ago, and in Europe, 20, 30, 40 years ago, they were using what they called the buttonhole technique. And there was a pretty well-known nurse in the dialysis field named Melinda Ball, and she literally brought that technique to light here in the US. And I studied it. I thought, this is awesome. This is great. Let's do it. We started converting all of our patients with a fistula into the buttonhole technique. And we had wonderful, wonderful results. So what it is, and this is fistula, your own artery and your own vein tied together. So this is your body. This is nothing artificial, nothing plastic. You take 2 good spots on your fistula, and usually it's at least 2 3-finger widths apart. The farther the better, but at least 2. And you use one hole for what we call the arterial. That's the blood coming out. And then the other hole is the venous. Now, you take regular needles and you're going to stick it in the same spot until you have a nice spot that scabs over the next day. Now, a while ago, I mentioned that if you stick in the same spot in a graft, it will tear it up and it looks chewed. That's graft. That's sticking a plastic. This is a fistula, totally different. It's very similar to an earring hole. I don't know if you can see, I have 2 earring holes. And you're basically creating a little hole, little spot like that. So once you stick it, usually it takes 2 weeks. So we stick it in the same spot. It's nice it can be the same person because we all have a different angle. We stick it, do your dialysis, next day or 2 you come back, stick it again. And then what will happen is you'll come in and there'll be a little scab. And so that scab has to come off. And I know that may sound gross, but when you take the scab off, you're going to see a little hole. And once you see that hole, we switch over to a dull needle, a needle that's not sharp. It does not cut. And we just slide it in after we get it cleaned and everything. And I'll talk about that in a minute. So the needle just goes right in. You're not puncturing, you're not sticking. You're sliding in a buttonhole. It's just like when you, for those of you that have pierced ears, the very first needle that goes in when you're getting your ears pierced, it's sharp. It's sharp. It has to get through all the flesh, all the cartilage. So you have a very sharp needle that goes through, right? And then after that, when I buy earrings, they're not sharp. You just slide right in. There's a hole. That's the concept with the buttonholes. And I'll tell you, just recently, the big dialysis chains are saying no more buttonholes, no more buttonholes. It causes infection. There's too many complications. Well, I can tell you, at Angelo Kidney Connection, we've been using buttonholes since we started. I have been using buttonholes as a nurse, dialysis nurse, for 20 years. So our infection rate is impeccable. Our complications, I could probably count on one hand. There are ways to monitor and prevent clotting. There's a way to measure pressures on the machine where you can get a baseline and you can see where these pressures are going, so you can fix things in a heartbeat. They last a long time, and sticking through them with a buttonhole is nearly impossible. I won't say it's impossible, but it's fairly impossible. The reason these big chains are saying don't do it, causes infection, is because their staff is not trained properly, or their staff is cutting corners. With buttonholes, with the fistula, it is important, 100% across the board important, that you follow these steps. When a patient comes in, we always say, wash your arm. Go wash your arm. Go step to the bathroom and wash your arm, right, with soap and water. And a lot of patients don't do it. They don't do it, or they don't want to do it. So regardless if our patients wash their arm with soap and water, we have a 4x4 with Germex. We use Germex. We get into their chair and we clean their arm with Germex. Both buttonholes. Scrub it with Germex, right? Then we take alcohol pads. And with those alcohol pads, we clean each scab. You still have the scab. We haven't touched it. Clean the scab with alcohol, right? And when you put the alcohol pad on top of the scab, it actually starts to soften it a little bit, so it makes it easier to come off. Then, and only then, after we've cleaned with Germex and alcohol, then we pick the scab. Now, on some of these buttonhole needles, there's what we call a scab picker. I know it sounds gross. It's a little plastic end, and you take it and you get the scab off. Now, it is 100% imperative that the scab comes off completely, and what you see is the hole. You see the hole right here. It'd be like a scab on my earring hole. You want to see the hole. Once you have the hole exposed, then you clean it with betadine. We're old school. We use betadine. We clean the hole with betadine from the inside out. That's my finger. I got it jammed in the door and it's still bruised. That was like a month ago. But you clean the betadine, let it dry. Let it dry. So now, not only have the patient washed with soap and water, we have used Germex, we've used alcohol, and now we've taken betadine, iodine, and clean the hole. Dries, just takes a minute or two while you're getting your tape ready, while you're getting your bandage ready. Then you take your buttonhole needle, the dull needle, slide it right in. I'm not saying it's pain-free because I have never had it done to me, but what my patients tell me, that the pain is so much less than sticking your arm with a sharp needle every single time. Sharp needles, you can infiltrate. What does that mean? That means you go through the artery. You're basically bleeding into the artery. You're going to have blood. You're going to have bruising. You're going to have what they call a hematoma. You may have a swelling like a golf ball. That's all with sharp needles. We follow the cleaning procedure I mentioned every time on all of our patients. Now, the big chains are saying, nope, 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 don't do it, don't do it, don't do it. But why? Why do they recommend it for people going home to do home hemo? Why? Because it's the best technique. If you're sticking yourself, right, you're going to stick in the same hole. It's easy. The pain is decreased. It makes sense. So why do they not do it? Well, high staff turnaround, people coming in and out, they're hiring people, firing people. There's too many hands. When you're first starting the buttonholes, it's really important that the same person do it, because they have a certain angle, a certain technique until that buttonhole is made. If you get somebody else in there, their angle may be different, and they may struggle. And some of these technicians, instead of calling someone over to help, they just go grab a sharp needle, they go right through that buttonhole, and that really messes it up. It messes it up. You know, it would be like me sticking my earring hole over and over again with sharp needles. Well, eventually that hole is going to be all messed up. So, you know, starting a buttonhole, it is important you have the same person stick it, right? Once they're established, anybody can stick it in. Honestly, anybody can stick it in. I will say tourniquets are important. And I know a lot of staff members get away from using the tourniquet, but the tourniquet literally opens up that hole. You know, you have your vein, you put the tourniquet on, it pops open. So for me, you know, if I haven't stuck someone in a long time, put that tourniquet on, guess what? The hole pumps up. The needle goes right in. So it doesn't matter how old your fistula is, they should always use a tourniquet. Complications of dialysis access: infection, especially with the catheters. High risk of infection because they're exposed. Grafts, same thing. Infection can get in under the skin and it can infect the plastic tube and you have an infection there. Fistulas, same thing. If you do not take care of your access before it's stuck, soap and water, Germax, something, clean your arm. Bacteria lives on the skin. It doesn't matter if you showered last night. It doesn't matter if you showered this morning. You still went outside, you got in your car, you rode in your car, you got out, you went into the dialysis center. You know, there's still bacteria on your skin. Very important. If you have a buttonhole, make sure your arm is being cleaned before. Make sure that scab is being cleaned. Scabs are dirty. Scabs are nasty. You have to clean them. Make sure they're cleaning that scab before they pick it off. Then, once the scab's gone, make sure they're cleaning the hole before you stick a needle in there, before you introduce bacteria. Because yes, you can have buttonhole infections. You can have graft infections. You can have a catheter infection. That's probably the number one complication of a dialysis patient is infections. You know, do the prevention. Prevent it as much as possible. How do you prevent a catheter infection? Make sure you're wearing a mask. Make sure your nurse is wearing a mask. Make sure no one's breathing on it. Make sure that when they take off the dressing, make sure someone's looking at it. Does it have drainage? Is it red? Is it crusty? Clean it up. Clean it up. Look at it. If it looks infected, they need to be drawing some cultures. They need to say, you know, check and see if it grows any bacteria. Another thing is, and each place is different, but on the caps that go on the catheter, make sure they're wiping them before they stick stuff in them. That catheter's laying on your skin, it's laying on your clothes, it's contaminated. Make sure they're wiping it with an alcohol or chlorhexidine or whatever it is they do. Clean it first before they inject stuff into it. That's how to prevent infection with the catheter. We won't talk about peritoneal dialysis because that's a whole nother therapy, and that uses a catheter in the stomach, so that's a little bit different. But in preference, fistula, because that's your own vein and artery. Graft, it's the next best thing because it's not outside of your body, it's inside your body. And then a catheter, of course, for emergencies or temporary, or your last option. So I feel bad for whoever is going to these dialysis chains and they're refusing to do buttonholes. Research it. You know, it's really the best technique for your body because you're creating less puncture sites. You're using a dull needle. You're going into a hole just like your earring hole. You're going in the earring hole. So much better, so less complicated, less infiltrations, and honestly, less infections. So that's all I have for today. I just want to talk about access. And for those of you that haven't started on dialysis, I know it sounds scary, but the more you know, the more intelligent decisions you can make. Ask questions. And I'm just here to bring the information, and hopefully it'll allow you to know what questions to ask. So we're always here. Give us a call anytime. You can send us messages. We will answer. So thank you, and we will talk to you soon.